Great evening to all. We know this is a weekend, and this is another episode from VC and Cathy. Welcome to VC and Cathy podcast. This is an episode 6. We are very happy that we reached up to the 6, and we love to proceed these episodes to the 100th episode. We will do it as soon as possible. But as it is in the every Saturday 7 p.m., we request all of you to stay tuned every Saturday at 7 p.m. And today, you already seen our thumbnail, and this is a very important topic too. And this is not related, mostly related to the mental health, even though we need to speak commonly and generally about this topic. So, if I want to explore about this topic, I need to say that now we are sitting as a registered nurse. But once upon a time, 10 years back, if you see, Cathy and me are sitting in the same classroom and we are learning something else. We doesn't know. We thought of coming into a medical field, but we step into a nursing. That time it was literally different. When we see the books of the nursing and when we go to the clinicals in the hospital, the realization was very much low until we get a licensed as a registered nurse and registered midwife and we practice alone in a hospital, alonely in a ICU, alonely in our ward. That time we realized how much the nursing is important. But nobody realized when they were studying in their classroom, when they opened their book and when they listened to the lectures in the classroom. And today is a very good topic and it is very related to us also. And episode 6 is from student nurse to the registered nurse. This is like how we are going to discuss about the transition matter here. Welcome, Cathy. How are you?
Yeah, I'm fine. Thank you. How about you?
Hi, Cathy. How are you?
Yeah, I'm fine. How about you?
Yeah, I'm doing good. And we know this is a Saturday and everybody enjoys well at this 7 o'clock. But we wanted to change something in our nursing fraternity. So it is happy to see you again in this week. And let's go into our topic. Do you want to say something about our topic?
Actually, when you gave this topic, I was recollecting my past experiences. What I was
Yes.
actually doing after 2018 after passing out. So I was recollecting
Hmm.
what really was my feeling then.
Yeah, of course. When I was picking up the questions for you, that time I was literally thinking about our past experience and past manners. Kathy, 1 minute. We are just putting on to the past for a second. Kathy, sorry, this was some network glitch. It was happened from my Wi-Fi. Can you hear me now?
Yeah, I can hear you.
Yeah, okay. Thank you. Uh, so we just step into our topic. So as we know, we have a signature about VC's Connect, and I'm just going to have a rapid questions to Kathy that eventually experience based round. It is not a one-word answer or one-line answer like a rapid fire. This is just we are going to communicate and we are going to have a conversation how it was when we were sitting in our student life, when we were sitting in our college. The first thing I want to ask you, Kathy, what was your first feeling after completing nursing?
Maybe I can tell a mix of emotions. Like sometimes I was
Okay.
anxious on what would
Hmm.
be my future uh, And sometimes I was overwhelmed with joy that I've completed my degree at last. So I'm gonna
Okay.
earn something on my own.
Mhm.
So there was mix of emotions. One thinking about my financial independency
Yes.
after that, and one thinking
Yeah.
like how am I going to settle myself in a new
Mm.
area? Like 4 years, I've worked in an hospital for training,
Yeah.
and moving into
Yes.
another area, hospital or clinical sector, that would be very difficult to adapt. So I was anxious about getting adapted to a new environment.
Okay. So actually, I want, as it is going to be a conversation between me and Kathy, so I want to say one thing. Once we complete our graduation, undergraduation, so 2018, we felt, that means specifically, I felt one thing. So the last 4 years, I was learning along with the guidance from my faculties and clinical instructors and nurses who are working in the hospital. But at the same time, when we got graduation, we were very happy that we got a degree as a faculty of nursing. But once we completed, that time I realized, oh my God, when I go into the hospital for the to get a salary, I'm just going to give a care to my patient. It is the patient, not only the patient, along with the patient, their families will be there. I was literally anxious that if I do something wrong, if I do something in front of them, and they will think that they, as a nurse, I doesn't know anything. So it is literally a responsibility. I just want to hold a single responsibility in my ward and ICU. I was literally out from that first moment. It was like the fire inside my stomach and butterflies. It was running here and there, flying there, and it was at most I was in something level. Why? Because we got guidance from many of the people, but now as a nurse, nobody will be helping you. And as Kathy said, we stepping into one area and we need to adapt ourselves to that. It is adaptation not only to the environment, it is also along to the senior nurses, it is also to the patient. When we are getting a clinical experience in our hospital, that is an internship, that time itself it was literally a different path. They were considering us as a nurse and they are giving educative feeding, and I was literally, it was a different exposure when I did my internship. At the last day I was thinking, okay, internship itself, it was interns, then if I go to my hospital as a working as a staff nurse, how it will be. It was a different experience, no, Kathy, when we step into a unknown environment and we work there. Yeah.
Especially more anxious since we moved to north. Language problem, communication problem was also there for
Yeah.
us. So
So
was very
actually,
anxious
we
about
work
that.
in other state. If we work in our state itself, our unitary itself, it is very difficult to manage the patient. But think that we went to Delhi and we were sitting in a corporate hospital and we are working without knowing a Hindi language. It was literally a different exposure as me and Kathy along with our colleagues. And the secondly, I need to ask you, Kathy, what advice would you give to your younger self? That means if you are before 10 years, so what is the advice you will give to the small Kathy?
Okay, not before 10 years. Maybe I would advise myself before 8 years. Like the one
Okay.
who was very keen to join MSc to do teaching. Because teaching was my
Mm-hmm.
passion. I used to say I'm a nurse by profession, by teacher, by passion. So I would like to
Yeah.
advise her, do not move out of your clinical setting within a year. Complete at least 2 years so that you get clinical competence, and then you go to MSc. That is what I felt. Obviously, I felt sometimes I used to feel that I didn't have a good clinical experience for like 2 or 3 years. I jumped for
Yes.
MSc suddenly. So I
Mm.
feel like I literally have a little of clinical experience than others. Like, and
Okay.
when I go to clinicals now for patient teaching, or so clinical teaching for my students, I
Mm-hmm.
literally feel myself as a student nurse. I too learn then and there. So that is what I would like to
Yes.
tell to my younger self. complete at least two to
Okay.
three years of clinical experience, and then move to MSc.
Then to do a master's. Okay.
Yes.
So if I want to say to my younger VC, what I would like to say is, don't compare yourself with the senior staff nurses. So
Yes.
I was literally comparing myself to my seniors, those who are working in the ICU. And then I got frustrated and my anxiety went into the depression that time. I was thinking, okay, I'm not capable. I was thinking, okay, I didn't get a good hospital exposure. That's why I'm just struggling here. No, it is literally not. When after that, I went to teach in some other colleges for the skill training. That time I realized what I got before 8 years, it was not even now they are not getting those experience, the college students. So that time I think, okay, we are blessed by the God and we got this much of experience. We are not lower to somebody else. We are just learning. Nursing is not like you're practicing it, not practice plus learning to be happen simultaneously in our profession, then only you can sustain in nursing. Yes, I want to move on to the third one, Kathy. What's one lesson you learned during your first year as a nurse?
One lesson I learned is like, I've already shared it. Like for us, it is next day a regular routine, but for patient it is not the same. For someone it is a very critical day. For someone it is a recovery
Yes.
day. So
Yeah.
I should have a deep empathy for each and every patient I care. That was the lesson I learned as a first year clinical nurse, staff nurse.
Okay. Okay, okay. So here, while we are speaking about this transition, I want to understand something, Kathy. Why is the transition from the student to the registered nurse is very challenging to us?
Okay, actually, this period is even called as a trans. We have a lot of theories on this,
Mhm.
especially Dusher's theory, which is very well spoken out. He the theory says that this period is called as a theory of transition or transitional
Mhm.
shock because they are taking a very big leap from a secure environment, from a safe environment to a person who takes a decision on their own. Like in a student nurse period, they were safe and secured by their ward in charges, clinical supervisors, clinical
Yes.
instructors, and so. But when it
Yeah.
comes to a nurse, registered nurse, or a novice nurse, it is a leap.
Mhm.
They should take over accountability. They should have autonomy, and everything is a sudden change. And sometimes
Mhm.
the new setting where they have been trained and where they are working differs. The SOP, standard operating procedure, for their
Yes.
trained
Yes.
institution would
Yeah.
be different, and for their working institution would be different. So this
Yes.
period is called as transitional shock, and there are a lot of theories. And one theory is that
Mhm.
theory of transition from new from a student nurse to newly graduated registered nurse. That theory says notices us at newly graduated registered nurse, and the transitional
Mhm.
shock is very common and challenging because of the entirely different setting.
Okay. So as you said about this SOP, not only at the SOP, there are many things it is different from hospital to hospital, and they have a set of policies for even not only for the care to the patient, it is also for the bank. So if you go to one hospital, they will open you a different bank account. If you go to the another hospital, they will bring you to the another bank account. It
How
is
many
each and
accounts are you
every
having
single.
right now?
I'm having more than five, and I don't know how much it is now open. So
Maybe you should
literally,
close
it is
a
closed
few you are not
automatically.
using.
Yeah, of course. So I think so. You also had the same experience when you work in the clinical. You they gave you one different account, and when you step into the faculty in college, you will be using a different one. And another thing, when we are working, we were studying in the college, we had a something else, different account while studying. So it is like it is not only the single part; it's segment. Each and every segment has a difference when you transit from the student nurse to the registered nurse. And while I work with some student, they wanted to come as an intern along with me in a hospital. I see those people, what they think is the confidence comes before the practice. No, literally, it was wrong thought that if they want to practice, if they want to gain the confidence, confidence will be coming once they get practice with something else. There is a quote that if you read for 100 times and you couldn't remember, that is not a failure. That is the winning path. You're making yourself to read something for the 100 times. So it is not that next day you're going to sit and vomit something. It is going to travel to the lifelong. That is what I need to say, that students need to adapt to this transition, because while they are getting practice in their college itself, they think that okay, we don't have mannequin in our skill lab, we don't have these kind of facilities here. If they want to see some other colleges in remote areas, it is literally very pathetic condition. They doesn't even have a single classroom to sit and learn something. They doesn't even have a book in their library. The room written as a library, but if you step into the library, no books are available for them. So wherever we are going, or we are listening, or we are sitting, we need to adapt to the particular transition level where nursing will be developed particularly. And secondly, I need to ask you, and I want to understand something. What expectations do students usually have? Why? Because I need to understand from you, because you are working in a college. As a faculty, you may listen to some students' voice. They might have said something, okay, ma'am, this is the problem with me, and that is not well, and I couldn't get this kind of knowledge or this kind of skills along with this particular college. So, what do you say that students are telling? There are more challenges, or some expectations are there?
Okay, this one even like I'll quote an example, but that won't be suitable for the forthcoming generation because we have a modified syllabus. Right behind
Yes.
in the annual pattern, we didn't have a subject called health informatics. We only
Yeah.
had computer science. So we
Yes.
just learned about Excel, Word, PowerPoints, and writing letters and so on. But now they are learning about hospital information system and management, and
Yes.
e-records, electronical databases, and everything. So when
Yeah.
initially a student from an annual pattern left out of my college and they joined a
Mm.
corporate hospital, they found it very difficult to adjust to that hospital information system. Like
Yeah.
in an emergency, we have to complete the initial assessment within an hour, a half an hour or 15 minutes or so. So
Yes.
they used to tell us like we are completing everything, we are giving good patient care and everything, but when it comes to management, hospital information system,
Mhm.
like we are lacking behind. If that would have been trained to us, we might have bridged the gap between our theory and the practice, they used to say. So nowadays those complaints aren't coming because health informatics, even there is a subject and they are learning about hospital management system. We have dummy softwares to teach our students how
Yeah.
to use it and so.
Yes.
So a little
Yeah.
modifications will be there when they go to an hospital, depends upon the
Mm.
hospital setup and so. So that one. So this is an example what they since what are the challenges they face is due to the expectations of what they learn in the theoretical environment and
Mm.
the gap which the practicum they get because they expect a mirror of what they learn in the theory, a
Yes.
setup of what, or the nurse patient ratio for the sake, for example,
Mhm.
or
Yeah.
the ICU setups or the ward facilities, everything. They learn something different entirely in book picture. And once, even during
Mm.
their training periods, they are exposed. Sometimes they ask me questions like, "Ma'am, we studied like this in book, but that is not followed in the hospital. That why
Yes.
aren't they following the same?" So that is what makes
Mm.
them difficult to adjust to a new situation because they are taught about something entirely different, saying this is the protocol, this is the rules, this is the guidelines, this is how it should be done. starting from nursing management, like ward management, how the ward should be planned, and what is the
Yes.
nurse patient ratio, or the facilities, how OPD should be in the ground floor, like everything they
Mm.
learn. And once they are going into environments which is totally new, and they don't see what they see in the book picture, like we say now, book picture, patient picture, like they don't
Yes.
exactly receive what they have studied theoretically. So that is what makes
Yeah.
them difficult to adapt to the new changes.
Yes.
I think so,
That's what I
because
was.
I've received feedbacks like that only. So I'm just sharing
Mhm.
my experience of my students.
Yes, of course, Kathy. Absolutely, I supporting this point because when we were studying the same syllabus, but now it was literally changed after 2019. We were studying in a year-wise batch, and now it is a semester-wise batch, and they are learning different patterns, and their competency level is different. The skill portions, what INC as mandated, is literally different. And this is, as I said earlier, this is not only getting something from the book. It is not only getting something from the Google or some other social media platform. It is just you want to go and sit in a ward, you want to go and sit in the ICU and get a exposure and get practiced and get adapted towards that thing. So the policies may change, but the name of the particular IV injection will not be changed. The name of the procedure, the riles to insertion will not be changed. The name of the OT surgery procedure and assisting in the surgeries will not be changed. Only there are little bit of changes, but we are not adapting to the same level of competency. But now I think so. This healthcare, it is booming many things. There are many things it is coming in. It is not only AI it is coming in. It is also the augmented reality, virtual reality. When I was conducting simulation training, now it is literally different. When I learned something else before 4 years, it was little bit different, and now it is literally changed, and many things has been adapted nowadays. As you said, it was absolutely correct and right, Kathy. And what do you think? And this is something a biggest reality shock when it comes to the student nurse.
Okay, the biggest reality shock is like uh, initially they expect professional ethics and
Mm.
professional career, but what they get is a bureaucratic career. Like as a student nurse, they used to care for a patient on their own pace of time. Like they get a lot of
Mm.
time as a student nurse. They care one to one patient or one is to two patients. But the reality shock
Mm.
is they have to take care of the whole ward. They should take their own decisions, and
Mm.
they have to. As a student nurse, they are facing only the staff nurses for a lot of time. But as
Yeah.
a staff nurse, they have to face all other healthcare professionals. That is a major reality shock what they receive actually, because
That is.
like I said, the bureaucratic organization, because workloads are very more, and the time constraints,
Mm.
because in student period our faculty do not rush us to do anything. Like in case of hair wash, it should be completed within few minutes, because the patient hair should be dried, or they may catch cold or something. But certain procedures we are asked to do slowly and calmly, without any fear, anxious, and panic state. But once it
Yes.
is nurse staff nurse period, they have patients to care, a lot of patients to care, a lot of documentations to be done. As a student nurse, we document at our own comfort zone, in our own diary. But as a staff
Mhm.
nurse, she has to document each and everything time to time for each and every
Yes.
patient. So these are the reality shocks which they face majorly as at the transitional period, and that can be
Mhm.
tackled by a lot of ways are there. Maybe we can discuss it in the forthcoming if you have
Yes.
any questions
Okay.
on that, I would elaborate it.
Yes, we are. As you said, we will be doing the same thing in the future podcast also. We will have a separate session onto it. And as you said correctly, that I want to say something from my side. Most of the people are thinking that procedures are changed or many things has changed. I want to say that nursing, if the reality, the specifically nowadays in this era, is not only providing a care to the patient. It is that how we are prioritizing the care to the patient. It is how you are communicating something to the patient correctly and structurally. It is not only that you are adapting to the procedure, it is also how you are communicating with the doctors and how you are engaging yourself with a multidisciplinary team. It is not only the doctors is going to save the life, it is not only the nurse is going to save the life. It is a teamwork. Now it is not going to happen without a team. Why? Because as the American Heart Association instructor, I do teach my student to practice themselves not individually in a team. You need to have a multidisciplinary team like a doctor, nurses, X-ray technician, OT technician. There are many technician and technologies are came into our field. So I would like to suggest our student nurses to learn something now itself how to work along with the team. It is not individual repetition and you are going to get extra salary. It is all the same that you work for the 1 year, you get this percentage of the hike. It is not the IT sector. Everybody will get a different hikes. This is a nursing. This is a healthcare. Whatever I do, whatever Cathy do, we both will get a percentage which is fixed already by the hospitals, which is already fixed in the college. So we are our vision and motto is not to get something else. It is just you're going to give something to a patient. It is that you're going to save somebody's life. So that is why I think that this is a reality shock, that even though people came into this field only in the name of the nursing, and they need to go to the abroad and to learn, gain or something, the salary or something, they want to get a green card and get a citizenship in that country. It is not only that. Wherever you go, nursing is same, nursing procedures are same, communication is same, the team is same. The nurse, you are a nurse only. If you go there, you are not called as a doctor. If you go to somewhere else, you are not called as a physician. So it is the word called nurse. Nurse will be it is a continuous one. It is going to increase. And nowadays you can see that many people are struggling to move on to the abroad, like for example the London, but there is a gate is closed by the NHS now because they already
Yes, of
have many
course.
nurses there. And many countries are voluntarily coming to India and they are asking to give a nurses to their country. So the life will be changing, but the word nurse will not be changed at any time. We want to adapt ourselves to those standards and the policies. So before 10 years, some procedure will be different, and now it was different. Literally, I'm saying many books we read, it is after many publications also the steps are same. But if you go and see the research articles, they are saying this particular sentence is not, should not be practiced now in the patient setup. So there are many and lot of things has changed, Kathy. And I would love to ask you something, that what quality will define the nursing as a profession, and nursing is a profession, and nursing is hamesha it is a profession only. What do you think about that statement?
What quality in the sense? So I don't get your question properly. Like
What qualities
to
define a professional nurse?
okay, qualities which defines a professional nurse is like
Yes.
uh, there are a lot of qualities, but one thing I would say is professional ethics, and
Ethics.
where the nurse should be very honest to her work, and she should have some core
Mm.
concepts like autonomy or accountability. Sometimes
Yes.
a professional comportment, that is liaison or cohesion between the nurse, the patient, and other healthcare professionals. So that would be a
Mhm.
good quality which could define a nurse as a very professional nurse. We have a set of ethics, professional ethics given by IC and International Council of Nurses. But what I would like to insist is like having autonomy. That is, a power to take decisions and accountable for their all their actions, and professional controlment, that is having a proper communication with all other healthcare professional, and uh, serving as an advocate between the healthcare professional and the patient and their family members would be very good to identify as a quality of a nurse to be mentioned as a profession.
Okay.
As far as
So
my
as you,
concern, this would
Mhm.
be that. But
The
when we
professional
say
ethics. Okay.
autonomy, certain
Mhm.
institutions doesn't give that autonomy to nurses. So that is where
Okay.
the nurse lacks her professional qualities, where she has to take
Mhm.
a lot of ethical, where she's pushed to ethical dilemmas sometimes.
Okay. I to think about discipline also to be added into this point. Why? Because when you are punctual, when you are communicating perfectly to a nurse or to a doctor or to a patient, wherever you go, you need to follow the standards. It is not that you wear a ICU scrub and you wear something else in your head. It is not that if you wear a ward dress and you're wearing something like a marriage shoes. It is literally a different place where you need to adapt yourself to that. And as you said, the accountability, I would love to ask you something. How important this accountability and communication is very much important. What do you think about those statements?
For a nurse or a student nurse,
Yes,
everyone.
for the nurses who
Okay.
has came from the student to a registered nurse.
First, they should take accountability that they about their mistakes. Like some
Okay.
three things they should not do is like
Mm-hmm.
they should not first hide their mistakes. They should take
Okay.
accountability for their mistakes. That
Yes.
so that they can correct their mistakes. And if they are not accountable for their mistakes, they are doing harm to the patient. If they try to hide it, they are actually doing harm to the patient. So accountability is very, very, very important. I
Mhm.
can say crucial, or it
Yes.
is very highlighted responsibility. We can go on adding adjective to that.
Yeah.
And
Yeah.
communication, as I said before, it is very, very essential. We even had a session on communication. We know how important communication is, because a
Mhm.
patient might not be very opened up to a doctor or to their family members, because we are the one who cares for them. Sometimes we give them that freedom to speak with us. We give them that freedom to speak out openly about their choices of treatment. Sometimes the
Yes.
doctor would say like you have to do this, but the nurse
Mhm.
will ask the patient, are you ready to do this, are you willing to do this, or is that uh, are you comfortable to do this procedure, in receiving this procedure. Those things are there as a nurse and a patient. So therapeutic communication is very, very essential between a nurse and the patient. And she should also be accountable for her own job, and she's also accountable for all the other ward staffs who is under her. Like sometimes
Yeah.
as a junior nurse in a transition period, she's accountable for her own work. But as days
Yes.
gradually passes, a senior nurse is accountable for all the works of her juniors, for all the ward procedures, or something missing in the ward, or something which the ward should be done. Like there should be some lacunae in the ward that should be met. So she should have a
Mhm.
sense of feeling that is my ward. That feeling and accountability only will put her in a very better place, and also communication.
Yes, of course, Kathy. If it comes to the communication, we already spoke about some communication tools in our previous episodes, and I want to enhance that one particular tool, that is ISBAR. So whenever we use these kind of different tools, which is already published in many researchers, but I want to say that it is not only we are going to communicate some information to the patient. It is also that we are taking some responsibility and we contribute something to the patient safety. We forgot about the patient safety nowadays. It was like many people think that They, if they follow some tools or something else, they go and they will do, they will come back. But nobody ever think about what happens to the safety of the patient. How this is the kind thing we are communicating to somebody else, it is going to share some information, some knowledge, something else too. But the patient safety is very much important along with the communication. As you said, accountability in this one, accountability is just I need to think from my heart, and I need to take that responsibility, I need to work for that. Or else what happens, everything will be like something we couldn't expect that will be happen to us. So as a nurse, we need to think about the communication, how we are communicating with the patient and others. And you need to take accountability wherever you are working. If you are in the ward, if you are in the OPD, if you are in some ICU or multi-specialty ICU, you need to take accountability onto that. And I need to ask that why student nurses continue learning after graduation. Like we can ask about you, like, are you learning now, or it is like you thought that 4 years it is enough and 2 years of masters is enough? Do you want to learn something and now it is happening, or students or the nurses need some motivation for that?
Actually, even continuing nursing education is essential
Mm.
for both teachers and the nurses. Like in new
Yes.
syllabus, there are something which I don't know, which I didn't study as a
Mm.
student. So I have
Yeah.
to learn that before going and teaching it to my students. Like initially, it was
Mm.
ICD 10 classification in mental health when I studied. It
Mm.
is now ICD 11 classification. So first, I should learn
Mm.
about that, and then I should go. The criteria for disease condition for diagnosing a psychiatric disease have had a lot of differences. Many diseases are ruled
Yes.
out. Many are termed in a new way. So continuing education is very very essential for both teacher and the staff nurse. For staff nurse, it is also very essential to bridge the gap between new practices. Like
Yeah.
there are emerging diseases, emerging medicines for new diseases,
Mm.
and even medicines which are overtaking the old medicines. Like the old medicine would have more side effects, and new medicine would have lesser side effects. So the
Yes.
nurse should keep on educating herself regarding the new innovations that would be done through continuing education. Even in their, like we have a lot of hospitals having weekly classes after a
Okay.
shift. They have to compulsorily attend classes in which new trends and innovations are being taught. Even as a teacher, we have in our college, we have faculty development program and journal presentation every month, third Saturday,
Mm.
so that we update our knowledge. We don't lag behind. Sometimes the students nowadays are overtaking us, overruling us if we don't know anything. So it is very
Yes.
essential
Yes.
for us to learn and gain knowledge about new things. And as a staff nurse, it is very essential for to learn new treatment methods, so that if there is a new instrument which is going to be used, she should know first how to operate that instrument, how it works on the patient, what are the indications for that, what are the contraindications, everything should be known. So continuing education is very
Yeah.
very essential. It is a part and parcel of life, not only
Yes.
for nurses, it is for doctors, it is for any sector. Continuing education is
Mm.
very essential, so that they have the capability to withstand in this changing era. If we don't update
Mm.
ourselves, then we will be outdated, we will be expired out of the
Yes.
profession.
Yes, of course. You said rightly, Kathy. Healthcare is not just like a book we are going to follow. It is evolving every day, each and every second, each and every minute. Many things has been changed in hospital setup and in college also. As you said that journals. Nowadays, people forget to read the journals which is given by councils and other publications. Every people are just go through in Google, or nowadays it is artificial intelligence
ChatGPT,
GPTs. Yeah, of course.
Perplexity.
Yeah, they got themselves into something. It is very simple, and they want to go type it something, get an answer, go. That's it. It is like a single short term thing. You are just getting information. but people forget to read something which is from a website where the research it is going on. As I said, the continuing education, it is not only in India, it is each and every country has their own continuing education. If you doesn't want a CNE, you can also get into a CPD, that is a continuous professional development, where you will not get any credit points from the council, but even though you have a satisfaction that I learned something today newly. So this is how people can learn and evolve themselves and get a knowledge and skills by reading something and getting updates from the research. So you said many things like continuing education. Now I need to ask you, Kathy, how can the younger nurses, that the passed out nurses, the freshers, can handle the criticism constructively? As you are a mental health expert, I need something like a standard forms or something like what you suggest the people to get right from this criticism.
Okay, there is nothing standard for this, because if we say something standard,
Mhm.
it won't work for everyone. Each and
Okay.
everyone's mentality is different, and some would
Mhm.
be reacting very maturely, some would be very immature. So we can't
Yes.
follow a standard procedure to accept criticism. But one thing what we
Mhm.
would like to, I would like to say is, like, first they have to receive the criticism and go through it once again in their mind. They have to recollect the criticism, why, at what point of time I was criticized, or at for what
Mhm.
mistake I was criticized. Was that mistake even a mistake or not? Was I criticized at the
Mhm.
wrong time, or where I was criticized, at before whom I was criticized, and everything. Because criticism as of like that, it is good for growth. But sometimes
Yes.
criticizing before patients or criticizing before a junior nurse, sometimes
Mhm.
would be very pathetic for that person, right?
Yes.
So we
Yes.
have to think of, even before criticizing, the person who criticizes also should think, and the person who's receiving the criticism also should think of it.
Yes.
Then how to adapt to criticism is, first they should know whether it was their mistake or not. Only when they
Mhm.
realize their mistake, they would be able to adapt criticism in a very healthy way. Unless and until they don't realize their mistake, they won't take the criticism in a very positive way. They might think like, it is their job or it is their nature to criticize always. Like, he always
Mhm.
criticizes all my works, like that they might just dust it off. So first thing is to think why I was criticized, and then is to think whether that was really my mistake. Only when they
Mhm.
realize that it was their mistake, they would be able to accept
Yes.
the criticism, and always have the mindset that criticism helps me grow. This can be given as
Yeah.
a common suggestion or a standard suggestion. Like,
Mhm.
always criticism, just take it as something which boosts you or which motivates you to make you a better person. So thinking in that way would help you adjust or accommodate to criticism, and take criticism in a positive way.
Yes, of course, absolutely, Kathy. So, whenever somebody says something else to us, we will really feel bad and it will be very uncomfortable to us. But we need to see something else. It is a key where you need to take that criticism, that feedback from the people, and you need to do a self reflection. Okay, the people said like this to me. So, did I did the same wrong kind of thing, or maybe the next time I can do the better thing? This is where the opportunity open, the door of opportunity open to learn something and make changes from yourself. Or else what happened, you will be doing the same kind of thing at the last till the death, you will be doing the same thing. So here the feedback is also very much important, and if it is a standardized, you self reflect yourself, then you can achieve anything else. This is where the opportunity opens for you. And now I need some advices from you, Kathy, as you are a faculty. Think me as a student that I'm asking you about some advices. So give me some tips for this. The three habits every nurse should develop.
Three habits, in the sense, one being honest.
Okay.
Like
Yeah.
being honest is very very essential, because
Mm.
sometimes they might do mistakes, they might hide it, as I
Yes.
said before. So you
Yeah.
always have to be honest to your work and to your
Mm.
patient. And
Yeah.
second one is like trying to work at a pace of time, like prioritize work, just doing
Mm.
without
Yeah.
any don't work disorganized way, in a disorganized manner. So you prioritize
Yes.
and organize work every day. Once you enter a ward, if you are assigned a few patients, just prioritize your patient care. That is one another habit. And the third habit is
Mm.
self reflection at every end of every day, so that you might able
Yeah.
to refurbish yourself for, or rejuvenate yourself for the next shift. Sometimes self reflections helps you realize what you did better today than yesterday,
Yes.
and what you did
Yes.
worse today, which should be corrected tomorrow. So
Yes.
one
Of
is
course,
being
Cathy.
honest, being
Yeah.
organized working, and self
Mm.
reflection.
Yes, I like the same thing that the my from my side also I will say like the self reflection each day about yourself. What has happened today? Do I want to change, or do I need to improve something else that will make your life better for the next day? That is a tomorrow. The tomorrow is not the one day. Tomorrow is the many years you are going to live long. And the second thing, every shift you want to get prepared in the morning. Whenever you wake up, please don't scroll your Instagram. Please don't scroll something else and see whether people put like to you, or people are sharing your post or reposting your post in the LinkedIn. It is where you need to take your paper, sit in a calm place and plan the day. That's very important. As a nurse, you need to plan everything in a half an hour, and then with the same plan proceed it, and the evening or before to your sleep, before to your bed, and take the paper and see whether you accomplished those things, whether you completed those things, whether you got something better from those plans. So this is where the preparation and planning is very much important for each and every nurse. And at last, I would like to say that you should not hesitate to ask questions to your seniors. The people think, okay, I am a male nurse. Why do I need to go to a female nurse and I need to ask questions? That literally a wrong thing. This is not about the gender. This is not about the age. This is not about what money you have. This is where you can develop. Ask question. Don't hesitate for anything else. If you are having some kind of shyness, go and ask to your friends, or call to somebody else who knows better than you. You need to, the reality is you need to think that the someone is sitting at the top, they know something better than you. That is where you can learn something from them, or else what happen, you will be in the same circle and you will not be coming out from the circle. So I would like to say these three things, Kathy. The one, as you said, it is a self reflection, and second, it is you need to plan your day at the morning, and third, it is you should not never hesitate asking questions to your seniors, not only your seniors, somebody else, maybe your juniors also. Some days I got some suggestions from my juniors where they gave an excellent one rather than my questions and answers there. So the second one I would like to ask you from this particularly the practical tips and advice. The three mistake every nurse should avoid.
Three mistakes every nurse should avoid. Actually, one thing I would say a nurse should avoid, you told as a habit, like
Okay.
they should avoid thinking that asking questions they might judge us. So never think
Okay.
people will judge you for your
Yes.
questions, and don't hesitate. So I would say it as a mistake. Do not hesitate to ask questions.
Yes.
So many
Yes.
people do it as a mistake. They never ask questions. One thing I would
Yes.
like to say. And the next thing is, as a nurse, like in student period, you would have friends, you would go to ward together as a batch and everything. You used to discuss cases, everything. But once you
Yeah.
are coming to a transitional stage, you have to maintain something. What you should avoid is discussing about your patients with others. Like, it is, if it is in a good way or if it is in a right way, that is okay. But discussing about your patients or your ward mates or your colleagues to the next ward, on to some other persons, or a third person, that would not make you a professional nurse. So I would like
Yeah.
to say, first priority is this one only. Stop discussing
Okay.
about your patients and your colleagues to others, that is not actually professional. And the second thing
Yeah.
is, stop hesitating to ask question, I would like to say that. And third thing is, like, there I told self reflection. Here I would like to say is, like, sometimes the mistake what they make is, they feel like they are doing self reflection, but what they do is they journal everything about patients, something. So
Yeah.
journaling about patients, as I said in the previous one, discussing about patients and journaling might be same, but journaling
Yeah.
about patients, that the diary might go to someone else also. And also, I would like to say is, set your own boundaries. People do not set boundaries at a workplace. That is a very major mistake. Sorry, I'm adding on to the three mistakes, but this
No,
one is
no
very
problem.
important, because setting
Yeah.
boundaries is very, very essential.
Yes. Yes. Of course,
So
Kathy.
that's very essential, because sometimes I I have echo. There is echo of my voice, I think so.
No, no, no. We can hear you. We can hear you.
Okay, fine.
Yeah.
Setting boundaries, that is very essential, because as a nurse, initially as a student nurse, they only speak with patients. So even as a staff nurse, the bond between the patient and them would be very good than the senior nurses, than other healthcare professionals. So we have to set boundaries, and connectivity should be very good in a professional way.
Yes, of course. What are the things you said? It is rightly need to stick into their ID card. They need to have those points into the ID cards. I think so. And I would like to add other three, that you never forget to be professional in front of the doctors, in front of the nurse, in front of your patient. Wherever you go, please be professional there. Don't forget this professionalism in the hospital. And second major thing, please don't compare yourself, which this thing I said earlier itself. Please don't compare yourself with anyone in hospital. You are different. You are from different background. You are from different college. You learn something different. So what you learn, you're going to do it as a skill in the hospital. Please don't compare yourself to some other in the hospital or anybody in the hospital, and don't stop learning. Please continue your learning after graduation also. These are all the major points we would like to add here about you should not do in a hospital, or as a nurse you should not do anything else. Never forget anything else here. And the last thing I need to ask as a practical tip, Kathy, how can mentors support a new graduates?
Okay. This nowadays many corporate hospitals are doing, like, they have orientation period, so that they bridge the gap between the theoretical phase and their practical, or the hospital in which they are going to get employed. So orientation trainings would be very helpful in training the new nurses, and also assigning buddy nurses in
Yes,
each and
yes,
every
yes.
ward. Instead of working independently at the starting point, working under some senior nurse would be very helpful for the junior nurse to learn more, and not to make mistakes at her first periods, because the first 6 to 9 months is where many people try to leave their job. They get a lot of stress, and they do not have a proper clinical experience since they leave their job at their 6 or 7 months due to their work
Yeah.
stress. So making them comfortable at their initial days will make them withstand their professional withstand their job in that particular area, and also also they should create a love or passion for that particular. For example, if I'm working in a pediatric ward, I should create my junior nurse should have passion towards the pediatrics, or she should know how to tackle a child with temper tantrums and everything. So teaching her such things on how what type of patient will be there, how I should converse with each and every patient. So teaching such etiquettes will make a junior nurse withstand in her job.
Yes, yes, of course. As you said, there are a lot of attritions is happening in hospitals, and they wanted to try that the nurses who are trained in the same hospital should not go out after 1 year or 2 year. Why? Because they spent a lot on to the nurses, the fresher nurses, to do a skill training for them, to do some CPR or BLS training to them, and to do some additional value added like NABH or JC accredited courses to the nurses. So this continuous professional development programs is also spent more money and more resources for the fresher nurses. And I would like to add one more point here. This is not only about the mentors. This is overall, like many people comes under a term called mentor. For example, the clinical instructor, the clinical educator, or some instructors who are working under some multinational organizations. So from the HR department, from the research department in the hospital, many has their role as a mentor for the freshers. As I said, when I went enter into a hospital as a fresher, many mentors were there. Without their guidance, I will not sit in this place, and I'm speaking about many things as some resources and resource person in many colleges and everywhere. But here I need to add one more point. The single productive conversation from a senior nurse will help a student nurse or the fresher nurse to gain a good confident level. Without that, nothing will be happening. Whatever you do in a training room, it will be up to the training room door. When you step out to the ward or the ICU, what happened? They will think about, okay, my senior is there, he will be giving some guidance, yeah, she will be doing some help to me. There are many mentors. It is not only the educators, it is also the nurses who are working in the ward, in the ICU, in the OPD also. They train their nurses. I went to one hospital in Telangana, Cathy. There I was speaking about my organization's courses to them. They said single thing to me: I have a senior nurses who has a experience of 15 years, 20 years. They are teaching my fresher nurses, and why I should get a course from you. They literally ask me. As you know, I am American Heart Association instructor. I was bidding for the BLS and ACLS courses for nurses. Why? Because they need to learn. She said one thing. So, okay, certification, it is a different one. You are giving some international certification, but it's when it come to the experience, they will listen only to the senior nurses what they taught in the ward or ICU. So this is a little point she said to me. Thank you, Cathy. This was very productive one. And the last, it is not going to, we are not going to finish without our signature one, that is a rapid fire. And we have some 2 to 3 rapid fires here. And I want to ask one thing, that one word that describes a great nurse.
A vigilant nurse.
Vigilant nurse. Okay. The one skill every new graduate should master.
Asking doubt.
Asking doubts. Okay, very
I
good.
would like
Yes.
to put it in a sentence. Like the safest nurse is not one who says I know everything. Is the one who asks and clarifies her doubt.
Yes.
She is the safest one.
Okay. Yeah. The one book or resource you would recommend to us.
Okay, I was just researching about this topic, building confidence for a newbie. I just came through a book. I haven't gone through it fully. I haven't studied it, but I went about the summary of the book in a journal. So it is from a author. She's a nursing theorist. She's 83 years old. Patricia Bennett. Her book, Novice to Expert Nurse. novice nurse to expert nurse. Actually, the book is termed like novice to expert, but it actually says nursing. And she's a very famous nursing theorist, Letitia ma'am. And her book, there are a lot of books about transitions about in her. And if you take on resources, resources are your seniors.
Mm-hmm. Okay.
Your seniors and the hospital policies are your resources, best resources.
Okay. That's something different answer for this particular sentence. Okay, yeah. Your final message, like, what is your message to the future nurses?
My message to future. I suddenly message is not rapid fire. I can't answer it in a word, right?
Okay, you can put it in a sentence too, Kathy. It is not. We are not limiting you here.
Okay. Be professional, compassionate, empathetic.
Okay.
So that and keep learning.
Yes, of course.
So that
Kathy.
you don't
Yeah.
feel like sometimes as a new nurse, the transition shock is only due to improper learning and guidance,
Okay.
and also due
Yes.
to communication problems.
That happens. That happens
So
mostly within
proper
us.
communication, professionalism, compassion, empathy, clarifying
Yeah.
doubts and learning. Those are the messages I would like to give to future nurses.
Okay, that is. We expected only one message, but you gave many messages to us. And thank you, Kathy. We got many points, and here we discussed many practical things. I would like to put some more words along with this topic. So, the nursing, it is not the single day practice. Nursing is not came only from by book. It is a skill based where you learn something from the book and you getting the knowledge from the book and you practice in the hospital. Without that, you will not gain anything else in future. The expert is not from the single day. Expert learns lot and many years, many years. She learned, and then they got a name called expert. So as a fresher nurse, please don't get demotivated. There are many people in our nursing fraternity. They are doing many lot of things to development of nursing profession and the education level. Here we are stepping into a simulation also nowadays. Before 10 to 20 years, only the doctors had the simulation training. Now we can proudly say, as a nurse, we are also into a multidisciplinary team, and we are doing some simulation training here. And I would like to add one more thing. So when I was working as a fresher nurse, I didn't learn anything else on the first day. It was the last 8 years I was struggling to learn many things in nursing, and I'm sitting as a clinical skills educator now, and I'm exploring some simulation level competencies in the futures. So don't get demotivated. This is a path. The roses will not be like very soft. The roses is also having a stem which consists of the thorns, many thorns there. So one while you're going to go into that path, you can achieve a very good medal or something else, and you are doing a betterment of the society here. Thank you, Kathy, for many points, and we would like to thank our audience also for this 1 hour session. We extended this from 40 minutes to 1 hour, but even though this will be very helpful for the fresheners, once they graduated, they can see this video and they can learn many things. As they will say, okay, I have a book. Okay, fine, they have a book, but the people will not have time to learn or will not time to study from the book. Where while you are going to travel from one area to other area, you will be doing some transition with the help of some bus or some bike or car. So there you can't open the book and you learn. Just listen to our VC's Cathy podcast so you can learn something else for the betterment of nursing. And thank you so much for to all, and have a great weekend and happy Sunday for tomorrow. Thank you, Cathy. Thank you so much. Bye.
Thank you.
Yeah.